Hello, this is my presentation on my proposal for my English essay. My topic is the Canadian government's response to COVID-19, creating more panic through inaction. My name is Rebecca Poirier, and this is for English 252. Introduction. COVID-19 seemingly took North America by surprise. We had plenty of warning given what Asia has endured for months, yet the Canadian government continually downplayed the threat to our country. This mistake has led to panic, hoarding, and general lack of preparedness on our country's part. Given the devastating effects of the Spanish flu, and more recently the H1N1 pandemic in 2009, our government already had previous experience with pandemics and should have been faster to respond to this current medical health crisis. The Canadian government's hesitation to enact safety protocols will have devastating repercussions not only for individual Canadians, but also for our economy as a whole. Learning from the past, the Spanish flu killed approximately 50 million people worldwide. I plan on discussing the differences between the city of Montreal and the city of Winnipeg and the responses. The city of Montreal was affected a whole month beforehand. The Spanish flu was transmitted predominantly by the military. So the benefits that Winnipeg had is that they promoted social distancing and self-isolation, as well as they also quarantined their soldiers. This led to a drastically reduced amount of death in Winnipeg versus Montreal. Then I will be discussing the H1N1 pandemic, and I will be taking my information from a journal on influenza. And in this journal, they discussed the different recommendations they had for improving the pandemic response. And I'll discuss how the government has yet to enact all of those procedures that were recommended. Consequences of lack of testing. We have a lack of testing kits, which is why those who are exhibiting symptoms are not always tested. Primarily, those being tested are those who have pre-existing conditions, such as asthmatics, those who are immune compromised. But they are not the only ones at risk of being hospitalized. We are now seeing more cases of people being hospitalized without pre-existing conditions. And more recently, there was a woman who died in the States. They have not come out and said that she did have this disease. However, she was tested for it. Originally, she was rejected for the test because she didn't have any pre-existing conditions. But when her health went and declined, they did test her. Unfortunately, her test results were not going to come in for 5 days after the day she died. So, still waiting on those test results and an update from that newspaper that I got this article from. I got it from the New York Post. I'm thinking also that I want to look into more articles on those in Canada who have been hospitalized without having pre-existing conditions, because I think that will support my argument better. The fact that someone has died in the United States, if this is truly a COVID-19 case, we'd be naive to believe that this won't happen in Canada as well. That those, not just those who have pre-existing conditions, are at risk for death. Next, I'll be talking about the economic impact. In the journal about H1N1, they talked about the potential economic impact of closing schools, that it would have a ripple effect, which we are experiencing right now. Had the government closed down the border to non-essential travel much sooner, we may have even been able to avoid this. Unfortunately, because they didn't, we now have our closed schools. We have parents who have to work from home, and they don't have childcare, so they're trying to manage everything. For us, we're trying to manage our kids' school, our school, and we've also experienced unemployment because we're getting laid off because our businesses are closed now. There are small businesses going out of business. For example, I plan to introduce the business of Baba Clucks in Redcliffe, that after 3 days after opening, they had to close their doors because they had no customers. They're most likely going to go out of business. The debt that's incurred from that. And the government is producing, sorry, dry mouth. The government is giving all these benefits to people now that are unemployed. However, the government could have avoided this debt that we're going to experience as a country had they closed the border sooner. So how should Canada have handled the pandemic? I'm going to be talking about a marketplace interview that was done with a family in Taiwan, as well as a government representative of Taiwan. I will discuss how their quick actions have led to relatively low numbers of COVID-19, even though they are right next to China, the country of origin. Quick action by the government has also led to no panic buying and people being able to find supplies they need. So when the government first heard about these pneumonia cases, they suspected China was not telling the whole truth. So they sent their own investigators, and when the investigators came back and said there's a problem here, they immediately began production on more face masks, as well as hand sanitizer. To prevent panic buying, the government set limits on hand sanitizer, groceries, all those things. Their stores are still stocked, while ours, we're having a lot of empty shelves. And the government of Canada has yet to intervene and actually set limits themselves. It's up to the individual grocery stores, which are still having a hard time meeting the demand. You will find Walmart, toilet paper has not been there for forever. If you do find toilet paper, it's the small packages and you really can't be picky. Hand sanitizer, sanitizing wipes are nearly impossible to find. If you go to Walmart, you're only allowed 1 jug of milk. If you go to Co-op, you can get 2 jugs of milk. So there's really no consistency. And if the government had set these boundaries, then there would be that consistency. Taiwan also is open for business still. Their schools are still open. They've set up partitions between the desks so the students are safe. Children are required to check their temperature before they go to school. You go to a restaurant, they will check your temperature before you enter the restaurant. They will also give you a bottle of hand sanitizer with your menu. So these are some of the things that Taiwan is doing to prevent the spread of COVID-19, and their economy is still thriving. Conclusion, an uncertain future. The government of Canada has had plenty of time to learn from past mistakes dealing with pandemics and has had months to prepare for this current crisis. The government's slow call to action will have repercussions for a long time to come. Only time will tell how well our country manages to rebound from this crisis. And these are my works cited. I have 2 journals, as well as most of my art. My research has come from current newspaper articles, as well as the marketplace video that I got the Taiwanese information from. And that's the end of my presentation.